I'm Brittany Lewis with Forbes Breaking News. Senator Debbie Stabenow discussed the mental health component to gun legislation on the Senate floor Thursday. The Michigan Democrat has been working with Missouri Republican Roy Blunt to include mental health measures in the Bipartisan Safer Communities Act. The bill was prompted after a series of mass shootings sparked a nationwide outcry for action on guns. Listen in for more.
I have to say this has been a wonderful partnership and a wonderful journey now for, gosh, almost 10 years, I think, that we have, since we originally started talking about the idea that we should be funding healthcare above the neck, the same as healthcare below the neck, as part of the healthcare system. And not through stop and start grants when we have community health centers are so wonderful for physical health. And so we have done that. I do want to, before going into the substance, give a shout out though, because we're not the only ones that have been working for almost 10 years. Our wonderful staff, Alex Graff on my staff, who has been working on this legislation for 8 of those years, and Caitlin Wilson on your staff, who was amazing, and I understand recently stolen by Senator Cornyn, and so she's continued her work. But so many people have worked with us that we're very grateful to, including the main authors and the folks that have put this bill together, like Senator Cornyn, who has been such a strong supporter of what has become an evidence-based quality initiative. We don't have to make something up. And when folks say, what do you want to do about mental health care or addiction care, we actually have a proven model now. And also to Kirsten Sinema and to Chris Murphy and Senator Tillis, so many people have been supportive of this as well. And I just want to take us back for just a moment, because when we came to the floor, Senator Blunt, when you mentioned 2013, we actually came to the floor to mark the 50th anniversary of President Kennedy signing the Community Mental Health Act. And as we know, that was the last bill he ever signed before himself being shot. And part of that was to stop housing people in hospitals, just locking people in hospitals, and create more quality care in the communities. You know, shut the hospitals, open up services in the community. Well, and as you have said so many times, half of that happened. The hospitals were closed, but we didn't provide the quality and the funding, permanent funding for the community care. That was 1963. We're doing it now in this bill. That's what we are doing in this bill, is completing what was promised in a national bill signed in 1963. So we know, again, that 1 out of 5 people in our country, and this is before COVID, will have a mental illness in their lifetime. So many leading cause of death, again, prior to COVID, for people under age 50, is a drug overdose, most likely opioid overdose. We know that the leading cause, the most likely gun death, is a suicide, which, by the way, in this bill, there's an important piece on red flags that I think is so important, because that means that if a family member, if those around someone feel that they are a danger to themselves and someone else and should not have access to a gun, they can go through a legal process to have that happen, so that that person is not using a gun to commit suicide or a suicide homicide through a mass shooting. But what is so significant about this is that we know that across this country, certainly across Michigan, I know in Missouri, we have so many people. I mean, there are millions of people today that want to be able to get help for mental health or addiction as part of the healthcare system. And we want them to do that. We don't want there to be a stigma. You know, there used to be a stigma. People would whisper, he's got cancer. You know, and now we openly talk about that. And we have the wonderful programs, and people get treatment, and there's no stigma related to that. It's very challenging, but there's no stigma. We want that for mental illness, for behavioral health. So this isn't about saying every person with a mental illness is dangerous at all, at all. This is about saying we want everyone to get the help they need, and in that situation, that rare situation where somebody doesn't get help and then takes those next steps and is unstable and dangerous, we certainly want to address protecting themselves, their family, the school, the neighborhood, the community, and that's what the gun safety provisions of this are all about. Let me just say one other thing and turn it back to Senator Blunt. We now have, between the number of demonstration states we've had now for a number of years, we also have 435 clinics, many of them funded through what we developed as startup grants so that they could get started, develop the quality standards, be able to show what a difference it made. But I think we were both pretty blown away when we saw the difference it made, when we saw those original numbers from Health and Human Services, the studies that were done, both in Democratic and Republican administrations, reinforcing that. The fact that right now, if you have a 24-hour psychiatric crisis services center, which is part of this, these clinics, people aren't going to jail. 60% fewer people going to jail because they're getting the help they need, which is why law enforcement so strongly supports this. Or what's been happening is people go to the emergency room and sit because there's no place. Our jails, our emergency rooms have become de facto mental health treatment centers because there was no place else. 41% reduction in homelessness with comprehensive care in the community. And that's what is in this bill. And it really is transformative, wouldn't you say, Senator Blunt?
So, Senator, and I think the points you're making here, too,